So, what do you understand by co-production?
Okay, so for me, co-production is an extension of involvement, which we now have fairly well established within our research and education forums. Co-production is more about the ideas being initiated by people that have a vested interest in that particular issue. So that's about sharing ideas between people who use the services, people who care for those that use the services, people working within them, those that have got expertise and academic knowledge around those issues, all kind of generating the ideas together and coming up with what might be the best ways to explore and find solutions to those particular problems. And that goes through the whole process, right from the very start, right through to dissemination and implementation of these issues.
What do you think are the key facilitators of co-production?
I think for me, from my experience, the key facilitator is relationships, and being very kind of transparent and authentic within those relationships, and being able to acknowledge where there is disagreement, different perspectives, where there are different levels of power within decisions that are being made around how you take agendas forward, and having the kind of courage to be able to be open about those things and appreciate that might mean that there are difficult conversations to have, but having the kind of relationship that can hold those difficulties rather than kind of pretending or ploughing on ahead without actually dealing with the issues and leaving some people feeling dissatisfied.
Yeah.
So Phil, what key changes are required in the approaches?
Well, I think it's something that our group's looking at is obviously around the power and the power imbalances between the different groups. I think, as you said earlier, the relationships are key in terms of building the kind of co-production kind of avenues that could be gone down. But I think we also, as professionals in the NHS in mental health, need to start thinking more about power, thinking more about how the power structures within the setting and the legal structure within society actually limit or encourage at various times co-production. So whilst we need to move beyond that kind of tokenistic, we're going to do co-production, to actually think about, well, whose interests might be challenged by co-production, which professional groups or industries might be challenged by co-production, and how do we actually, as best as we can, make practical changes that actually redistribute, if that's possible, power more to the people that actually use our services rather than the people employed by our services.
Can you give some examples of where you've observed co-production in practice?
Well, something that obviously the various groups that we work with at the moment, so that's kind of combination of Nottingham University, Power, and Notts Healthcare Trust. We're obviously trying to work around ward rounds on inpatient settings, which is a very difficult area, and where shared decision making is very hard, and co-production is incredibly difficult. I guess we're at the early stages of that in terms of bringing together academics, clinicians, service users, carers, the involvement centre from the trust, to actually develop the questions of what we want to know about ward rounds from service user, care and staff perspectives, but also then using a co-production to do further focus groups and actually develop a different model of shared decision making on wards. And I guess the next stage, which is going to be the most challenging stage, is actually how do you move that actually into the real kind of the real ward round in actual practice, with its constraints and legal constraints and staffing constraints and all that kind of thing. But the hope is that this will be a genuine example of kind of co-production in terms of changing practice locally. But as you said right at the beginning, it's going to be the relationships between the group of people that can influence things that's going to be key, and bringing everyone on board to actually give us the best chance of changing practice. Thanks, Gemma.
Thank you.